Welcome back, everybody. Today, the City of Austin is launching a pilot program aimed at improving its response to mental health crises. The program is called the Austin Field Integrated Response Support Team, otherwise known as Austin First. Here to tell us about how it works exactly is Captain Krista Stedman with Austin Travis County EMS. Captain Stedman, welcome and thanks for being with us.
Happy to be here.
We always like having you here in the studio, but I know that this took a lot of work to be able to create this teamwork, and we'll talk about the resources that will go into this, but how significant is this?
So this is huge for us. We've been responding to mental health emergencies in the city for years and years. And over the years, we have integrated things like our partners at Integral Care with the expanded mobile crisis outreach team, and this is just another step further from that. What we found is we've been able to manage sort of low and medium acuity calls really well, but we identified a gap in those high acuity calls. So these are our patients that are having some sort of mental health crisis, and they may be a danger to themselves or others. So by building in this team that we have now, we're able to address those even faster.
I understand this involves several different agencies all creating this team, so explain what they all will do together.
Yeah, so it involves one paramedic from Austin Travis County EMS. That's one of our community health paramedics that's trained in mental health response. It's also an APD officer and a mental health clinician from our partners at Integral Care. And all of these folks are experienced, tenured providers in the mental health field. And so we're just leaning into that expertise. They're all together in one vehicle, traveling around together and taking care of folks.
Just to put a finer point on it, what kinds of calls exactly will they respond to?
So like I said, those high acuity calls, right? So somebody that is in mental health crisis and may pose an active threat to themselves or someone else. These are the more dangerous situations than someone who, maybe is just having some suicidal thoughts or something like that, but is sort of low key. These are the patients that may act on something. And that's why we have the three elements built in. We have the police officer for the safety aspect, we have the paramedic for the physical health aspect, and then the mental health clinician.
And it seems that would just be to fast track some of the response and to getting that help quicker to the people that might need it.
Absolutely. And when we look at outcomes for these kinds of patients, what we find is starting de-escalation as early as possible is really paramount. And by having this team together with all of their expertise, they can start that almost immediately and really start working towards getting these patients the help that they need.
We highlighted there that this is just a pilot program for now. Is there a certain time limit or time frame that you all are hoping to run this?
Yeah, so we're going to run it for 6 months.
Okay.
At the end of the 6 months, we're going to take a look at all of the data and the metrics that we're tracking and see, what we may need to tweak or reform, and if this is as helpful as we hope it will be.
And you've touched on it just throughout your answers, but what is it that sparked doing this and taking this approach and creating these teams to go out and respond to these calls?
Yeah, so like I said, we've had a similar model in the past, but it did not address these high acuity calls the way that we would like to. And so the idea is to get the most experienced providers that can address the safety aspect, the medical aspect, and the mental health aspect all at once in tandem with each other.
Well, again, this new pilot program is launching today, and you can read more about that on our website at KXAN.com. But for now, Captain Krista Stedman with Austin Travis County EMS, thanks again for being with us.
Always happy to be here.